Sexual health is important, and knowing where you stand helps you protect yourself and others. However, sometimes people decide not to get tested for STDs, either because they're unaware of the importance of it, or they fear what the results might say, or how they might look. Sexually active people, especially those with more than one sexual partner, will always have a chance of contracting an STD or an STI. In fact, STDs are more common than you might think. According to the World Health Organization, more than 1 million sexually transmitted infections are acquired every single day, and the majority of them show no symptoms. This means you could be a carrier and not even know it. While sexually active people are at a higher risk for contracting STDs, regular testing can help spot any infections before they get out of hand. You might even consider making it a part of your annual physical exams. The CDC provides the following guidelines for who should receive STD testing. Sexually active women. Sexually active women under 25 years should be screened for gonorrhea and chlamydia. In addition, women over 25 years with one or more sexual partners or new partners should undergo STD testing. Adults aged 13 to 64 should be tested for HIV at least once. If you share injection drug equipment, you should get tested for HIV at least once per year. Men who have sex with other men should be tested. These men should go for chlamydia, gonorrhea, HIV, hepatitis C, and syphilis testing at least once a year. Pregnant women. All pregnant women should go for syphilis, hepatitis B and C, herpes simplex 2, and HIV testing early in their pregnancies. Routine STD testing is important to protect the unborn baby. And people who have oral and anal sex. Talk to your healthcare provider about other testing options for you. Testing is the most effective way to know if you have a sexually transmitted disease. Many sexually transmitted diseases don't exhibit obvious symptoms or any symptoms at all, making them dangerous for you and your partner or partners. Factors such as age, sexual orientation, how often you have sex, relationship status, whether you have engaged in high-risk encounters, and the number of sexual partners you have are key to know how often you should get tested. Everyone is recommended to get a yearly test, regardless of their relationship status. You should get tested for STDs if 1. You are in a new relationship. Going for an STD test after committing to a new romantic relationship benefits you and your partner. The test will reveal if there are any unresolved STDs that you were unaware of from your past relationships, and you'll be able to take care of them before engaging in any sexual activity with a new partner. Have an open conversation with your new partner about giving you the same courtesy. Remember, this isn't solely a trust issue. You or your partner could be carrying an STD and not be aware of it. 2. You are sexually active with multiple people. Going for an STD test every 3 to 6 months is advisable if you're engaged with multiple partners. Having relations with multiple partners means you are in a high-risk group. Therefore, you are more susceptible to diseases like HIV, syphilis, and gonorrhea. 3. You previously tested positive for an STD. People who have previously experienced an STD are more likely to be reinfected. Going for a test 3 to 6 months after originally testing positive for an STD is crucial for your sexual health. Remember, if you're at risk for one STD, you're at risk for all. 4. You have unprotected sex. You should go for a test if you have had a sexual encounter with someone without using a condom or other barrier methods and are unsure of their status. However, you might consider waiting a couple of weeks before going for a test, since it can take weeks or even months for the virus or bacteria to reach a detectable level. Or you should be tested multiple times across the coming weeks and months. For instance, it can take up to 2 weeks for chlamydia and gonorrhea infections to show on the test. 5. You begin experiencing new symptoms. Some of the symptoms that can indicate you have an STD include unusual discharge from the penis or vagina, a painful sensation when urinating with or without an unusual odor, lower abdominal pain, pain during sexual intercourse, pain around the testicles or scrotum, lumps or growths near the genitals, and blisters or rashes on your body. Getting tested is the only way to know if you have an STD. Some sexually transmitted diseases show no symptoms and thus may leave you vulnerable to serious complications later in life, like infertility. Some STDs can even be fatal if left untreated. Regular screening for STDs allows for earlier detection and treatment. Getting tested for STDs is simple and quick. E7 Health National Testing allows you to order discreet and private testing nationwide, and you don't need a doctor's order. All you have to do is order your test online and select a lab site from over 2,700 locations across the country. We typically deliver lab results within 2 to 3 business days, and we'll send them via a confidential electronic patient portal. If you've tested positive for an STD, a provider will call you. Should you need treatment, consultations with a medical professional are available. There is no shame in getting tested. This is the simplest and most accurate way to protect your health, as well as the health of the people you engage with. Schedule your STD test today with E7 Health National Testing.